That sinking feeling in your stomach, is this going to bankrupt me? Can I afford this? And you don't know, there's all this uncertainty.
And you just kind of hope like, okay, I hope nothing happens.
3 hours for a broken collarbone, even $20,000. I'm like, what? Like, what in the world did you do? Are you serving caviar in between x-rays?
Healthcare is just so central to any American's budget. The work that we're doing, of course, we're talking to policy experts, people who design different kinds of policies. But what we really wanted to do is talk to the people who are experiencing this cost acceleration.
I'm from East Lansing, and I spent 15 years working as Casina here.
I'm Joanne Galloway, and I live here in Lansing. I've spent 30 years of my life in the Eastern Upper Peninsula, either being raised on or operating a under-resourced family farm.
My name is Merrick Green. I'm a veteran. I served 23 years in the Air Force.
I'm a single mom, so I had two jobs in my whole life. Now I still 2 jobs, but it's not enough.
I found a plan, but the plan still costs $500 a month. Last year, this year it's about $7. And even with a plan that costs that much money, I still owe Geisinger like $20,000 for surgery, chemotherapy, CAT scans. There's a button in the My Health app you get on Geisinger that says can't afford your payments, can't afford this amount, make a payment plan starting at $696 a month. I can't afford that. I don't know what I'm going to do with that. I really don't.
I had to pay $150 for one of my prescriptions that was literally $10 the month before. Wow. I'm a registered nurse. I take care of sick people every day, and I struggle to afford my own health care. And just think about how backwards that is.
Mm-hmm. We paid about $850 a month. This year we're paying $1,500. It doubled
in 1 year.
But the quality of the insurance is also much less.
My deductibles doubled, and our company is self-insured. You know, people like me that are younger and healthy we're just going to drop our insurance because we're not going to pay that price.
Most of these plans now are high deductible. So let's say your deductible is $4,000. So you're never going to hit that. And then your next year rolls around and your deductible resets to 0. But now you have this additional bill that you're paying off on top of your insurance every month that you're already paying for. So it's almost like, why am I going to pay all this money for insurance every month and you guys don't even really cover anything?
So I got a $2 an hour raise this year, which was immediately went straight to my health care. I'm still treading water.
I went to Puerto Rico for family emergency. Came back, my medications were, I had a refill on, but I didn't have money for it.
Because you needed the emergency expense.
So because of that emergency expense, my cholesterol pills, my diabetes, everything that I needed to function every day, I couldn't buy it for a month. I'm still struggling.
It is so hard. Medicare. The insurance in my job, I'm paid a little bit more than $200 a month, plus medication, plus X-rays for each knee. I was thinking, you know what? Maybe next year I don't want to pay the insurance. It's more than $200, but I can. I need the insurance.
Like every time he got a pink eye or an ear infection, it's like, okay, it's going to be $80 for the visit and then whatever the cost of the medication is. Yeah, that happens every like 3 weeks because he's this big and again, licking everything.
I never used to have a copay. Now I have copays at doctors. Never used to have a copay for medicines. Now I pay for medicines.
They won't cover another brace to replace this one for another 4 years. This one is starting to wear out. I cannot afford one. This one was over $600. I only make $13 an hour. I work 4 days a week. I do work. It's not that I don't, but I can't work 5 days like most people.
What is this facility fee? And they're like, well, because you went to the clinic. He goes, but the clinic's in the hospital. So isn't it just it's an office in the hospital. Oh no, it's not part of the hospital. Yes. It's a separate entity and you have to charge a facility fee. Who did make this up? Because I never heard of that.
The surgery may be covered, the doctor may be covered. The anesthesia that you're getting during the surgery is not covered. And then when they find something and they send that away, that pathology is a different department and not covered either.
Right.
You don't have a choice.
I called to make sure that he was covered by my insurance. The facility wasn't covered. So I ended up with a $1,000 charge. Jesus. Who could possibly know this? Who could navigate this?
I always have medical debt because of the deductible at the beginning of the year. I put everything on a payment plan with the hospital, and then I just slowly pay it off. And I pay it off like around December, and then it starts over again. So I just always have medical debt, just in a big circle.
Where everybody's using the credit cards. Yes, but what about the interest rate? You're killing the people. We're struggling.
I have Medicare, it's a supplemental, or what it used to be called Medigap, you know? Okay, well, every year my premiums go up.
Well, how much is the surgery going to cost? You're scheduling me for a hysterectomy because I have cancer. Like, what is this going to cost me? And you can't give the patient, I wanted to be able to say, this is how it's going to impact you.
What I do worry about more is like checkups that I might miss. Like, for instance, I didn't do a mammogram and I need to do a mammogram, but I just really cannot afford
preventative care.
The cost for that. The cost for that one. And we can't afford to take that money out each month because like life happens.
I spent 8 years as an auto mechanic, and people would always come in with an emergency that's wrong with their vehicle that could have been prevented for far less. And it's the exact same with healthcare.
We spend so much time at the table fighting for just keeping what they have. Gains are something that we just don't have. We put so much effort into keeping healthcare, keeping retirements where they are.
That would be beautiful. I would argue that having just a capped amount that was affordable for people to be able to pay, that's what you're gonna have to pay, period, would make all the world of difference for people.
Us being the richest country in the world, it shouldn't be a thing that people who are dying from a horrible disease need to fight to get health care.